We're really, really lucky to have a person who is just such a go-getter. Joyce Lee is known by many as one of the real leaders in New York City's fit city planning, the active design plan, and she's going to share with us some of her information during that time, and I hope a little bit about what she's doing now. Joyce.
Hello, good morning. Joyce Lee, thank you for having me here. I am an architect, and I'm serving as a fellow at the National Leadership Academy for Public Health this year. And some of you know me, from New York City. Yes, I was the chief architect of New York City Office of Management and Budget and served as the city's first active design director. And very happy to share with you some of what I have learned and how it may get interpreted. Because of the two MDs before me, I think there's incredible evidence. How do we take it to the built environment? And being a green architect, working with USGBC very early on, I like to kind of take a step back. When LEED was very new in this country, I was very excited, and I took it to the elected officials and the appointed official in New York City and say, you know, we really need to pilot this great system in New York City projects. But nobody really knew green or blue or yellow. And I had to do a back of the envelope argument way back then and say why we should be doing it. And looking back, when I was making the argument, I was actually less making an argument about sustainability, about energy and water. I just said, if we have this green building that can help all of New York City workers have one less sick day a week, that is, at that point in time, $55 million in productivity gains. And I guess then the bosses said, okay, go ahead and try it. And that was in Mayor Giuliani's era. And I think a lot of you know what Mayor Bloomberg has really done and taken this off since then. But I think some of this really rings true. And I'm so glad that Charlene shared the slides on Carnegie Mellon studies about the workplace and what we spend where? Because this back of the envelope calculation over 12 years ago, in 84% personnel costs, 1% on energy, and 15% on real estate costs, correlates exactly with Vivian Loeffner's studies. So it really holds up to argument why we should be looking at the people part of it more. So some of you are familiar with the active design guidelines. I have a copy for those who would like to look at it. We were very fortunate under Mayor Bloomberg's leadership. The health department, city planning, Department of Transportation, and Department of Design and Construction get together. I was at the mayor's office at the time to work on this collaborative effort to produce a book that talked about the health background of physical activity, based on CDC research. And then what are the implications in urban design, in building design, and synergies with green building. So this one is on the urban design, how we actually, again, take the medical evidence and translate that into the built environment at the street scale. Good lighting at the pedestrian level, wide sidewalk, articulated storefront with canopies that provide sunshade and shelter from the rain, providing seating at strategic location so pedestrians can actually see that they're going somewhere, and if they need to rest, that's a place to. And on the right-hand side, you know, sidewalk cafe, food is always a very good incentive, and you will see that activity on the street when you have these kinds of quote-unquote street furniture there. At the site level, what could we do? And a lot of us talk about, you know, whether or not that's the money to do it. The truth is there are projects being designed, planned, constructed, operated every single day. The question is, how do we find that in the portfolio? On the lower left-hand is a public school that used to be custodial parking. And if you go to any school custodian, they don't always tell you that there's excess space for physical activity. You have to find it. And a splash of paint does not cost you very much. Same thing with low-income housing. Upper Manhattan, a courtyard that could be just raw concrete, you know, perhaps with gang violence. But when you do something like this, like a play mount and another splash of paint, that adds hours of physical activity to children. For market rate housing, when the gym and the children's playroom are already programmed into a high-rise building, Why don't we put them adjacent to each other? So there's parallel exercise opportunity for both the parents and the children. And don't ever estimate the power of art. Public art as a destination point, they draw people together. And on the right-hand side is an art festival. You see the little child on the right. What do they say about life imitate art? So with all of this work and with the help of the U.S. Green Building Council, we actually proposed a physical activity innovation credit. At that point in time, the review team didn't quite know what we were trying to achieve, but basically taking a lot of the strategies that we talked about earlier and package that into a green building credit. And this is a project that we were working with the Perkins and Will New York office. They had a children's hospital under design already. And I would say that the stairs and all of those vertical infrastructure was very much in place, but making sure that the doors are open, making sure that there's daylight and view, making sure that the outdoor spaces for all the occupants in the building, including the doctors, to the janitor, to the staff, to the visiting family, to the patients, having a variety of physical activity, opportunities is extremely important. And if you look at the lobby, this is just good design, having daylight, having art, and having prominent stairs where you don't really see the elevator. It's a big plus. So they were able to, and for those who are familiar with LEED, make the point and get the innovation credit. And now we are very excited to hear from the council that it's a formal pilot credit. This is a building at CDC. And with your federal portfolio, people are building LEED, and I will see many of this type of building at NIH as well. I mean, things have really changed in the last decade. CDC has this their prom call, Go Green, Get Healthy. New York City has burn calories, not electricity. And for those of you who know that I recently moved to Michigan, we now have Get Healthy, Save the Earth. Same idea. And again, when I arrived in Michigan, where I relocated to, I was very happy to find that a local university is already doing a STAIR campaign. So last fall, we have this university, Grand Valley State University, 20,000 students doing the STAIR campaign, and started working with the community. This year, this fall, we're going to have 5 universities doing STAIR campaign at the same time. We did talk about how important is the interior for physical activity. Angela touched on that. Why do we have to penalize students for being fidgety? Can furniture remedy that? Could they have wheels? Could they turn around easily? We talk about treadmill desk, and on the 2 slides above is a recent New York exhibition on schools of the future. At the street level, when you're looking into the gallery, you see these desks. Traditional classroom. And then you look through the window on the right-hand side. They actually look down. At the AI New York, we pull back the slab, and we have classroom of the future. This is a project that I'm currently involved in Michigan. Many Midwestern cities going through downtown revitalization, economic development. This is an art festival that would draw 500,000 people every year. And Time Magazine has just mentioned this as one of the not-to-miss events in 2003. So they have a 3-mile, 6-mile, 9-mile walking route to see art during the festival. And we're working on making this very visible. I guess for those Google colleagues in the room, we love the Google platform, because it really allows you to begin to visualize. The map that you saw earlier is something that's very static, and you would notice Google Maps platform with the address, with the directional signage, and the little person at the right-hand side, where you begin. Once you put the route in place, you're telling people how far they're working. It talk about the challenge that I think James had mentioned. People really begin to visualize where they're going, and it is one of the buildings where they're going to be seeing art. Okay. For those who are familiar with LEED, I think, we can talk about this much longer, but I think there's a lot to look forward to in LEED. These are some of my favorite future credits: ergonomics, walkable project site, and 2 that I have invested time in, designed for active occupant. and urban agriculture credit. And I'll end on this slide because this is not only going to take another 5 minutes, but 5 hours to really talk about access to healthy food. But what you're seeing is that at the higher education campuses, there's a lot of investment in access to healthy food. And at the K through 12 level, you see today the value of what students learn now. Thank you.